Hello, good afternoon, and welcome to this Ask Me Anything session looking at the Cambridge University Professional and Continuing Education Institute courses of clinical research, education, and leadership, leading on to the Masters in Clinical Medicine. My name is Thomas. I'm one of the course directors on the course, and we're joined today by Tom, who is one of the course directors as well, by Rosie, who is one of the academic administrators with the Institute, and then we have three um, current and recent students of the course who are here to help out with any questions as well. Did you want to introduce yourselves quickly at the start, or when you come in with any questions?
Yeah, I'm happy to introduce myself if you
Thank
like.
you, Catherine.
Yep. My name is Kauthar. I am currently on the clinical diploma, and I had a really good experience with the certificate as well. And I'm keen to share that with everybody who's joining today.
Thanks. Sharif.
Hi, my name's Sharif. I'm currently doing the PG Cert in Clinical Research, Education and Leadership, and I'm about two-thirds of the way through now. And yeah, I'm happy to answer whatever questions anyone's got.
Ilias.
And hello, everyone. My name is Ilias, and Thomas's hint to someone being a past student, that's for me because I've just finished the master's. So I've completed the Master of Studies through the pathway of CREL to clinical medicine.
Rosie.
Hi, I'm Rosie. I'm one of the administrators working on the clinical medicine course at PACE. So I work alongside Tom and Thomas, doing all of the sort of back office admin, administration, things like that, particularly making sure that students have got a point of contact with their email address as well throughout their studies.
And Tom.
Thank you. Hi, my name's Tom. I'm the course director for the MST in clinical medicine, so the final year of the program. I've been involved in the development and the design of the program from its inception, and I lead on the research module in the postgraduate certificate year.
Thank you all so much. And hopefully you get the idea that between, all the people who were here on the call, that we have that wide range of experience and knowledge to be able to answer any things that you might have to ask us for today. So really to kick off, to give you an overview of the course, it is a progression pathway where there's a certificate, a diploma, and then a master's, but you can do certificate and then not carry on to the diploma, not carry on to the master's, and come back in and dip out as you want. The first year is the postgraduate certificate in clinical research, education, and leadership. And these really are the three things that we know that people in that early to mid-career progression through any of the clinical pathways need to be able to hit for their job descriptions, for their career progression, for their specialty training, for their training posts, and also for, applying to their own general development as a modern clinician. We know that these are three of the things which crop up a lot on that self marking in terms of jobs and job interviews and rankings. And perhaps these are three of the things that aren't really hit at a very thorough level in the undergraduate clinical curriculums. And that's why we say, well, actually, this is your chance now to catch up with all of that and get those things that you require. In the certificate, there are three modules: clinical research, which, as the title suggests, focus in on the nuts and bolts of being able to carry out clinical research, well, and research in a clinical setting rather than clinical trials, being able to look at research and evaluate research and be able to see, well, what is robust, what can you take, really how to have the language and the skills to be able to analyze these things. The clinical education module. And again, that is focusing in on getting from the point of being, an amateur in medical education and clinical education to having that formalized approach where you can do it as part of your job description, without having to just tread water and knowing you can justify what you're doing. And then we have the clinical leadership aspect, which, again, as the title suggests, is looking at those leadership skills, project management skills, people management skills within a clinical setting. And as part of that, you undertake a quality improvement project, which runs through the course, runs through that year from start to finish. Then at the end of the postgraduate certificate year, you can progress to the diploma and then onto the master's, or you can decide at that stage this is what you want to achieve and you're not progressing any further. But we've had lots of people who have progressed through to the diploma and the master's, just like the people on our call today, and for whom this has really been beneficial for their careers and their own personal development. So I'll hand you over to Tom now to talk a bit more about the diploma and the master's level of the course, and then we're going to come back and go into our questions that are coming in on the question part in the chat there. Thank you.
Thank you very much, Thomas. So yes, as Thomas said, after you've completed the postgraduate certificate in clinical research education and leadership, you have an option if you want to progress onto the postgraduate diploma in clinical medicine. The requirements for progression are that you pass the course. In the postgraduate certificate year, there aren't any set marks that are required, but you are needed to pass the entirety of the program. And the same is true if you want to progress from the postgraduate diploma to the master's year as well. So at the moment, the diploma year has focused on providing a slightly wider range of topics and also exploring some of those broached in the certificate year in more detail. So, for example, there's an advanced leadership course, which provides an opportunity to delve into more depth on the leadership topics that were picked up on in the certificate and to give you more opportunity to apply that learning to your clinical practice. We also at the moment have modules that deal with healthcare data and with law and ethics in a medical context. And those again are pitched really as an introduction to both sets of topics to allow students to get a feel for how those areas apply to their day-to-day work and how they might be able to use those areas in their work as they develop through their clinical careers. One of the things we're in the process of doing at the moment on the course is revising and revisiting some of the teaching that will be delivered in the diploma year so that we can make sure that we respond to the student feedback so far and provide a course that is exactly tuned to the needs of the student. And so we're likely to lead to a restructuring of the course over the next couple of years. The core material will still be contained, but will also include some more advanced information about research and education within that diploma year. For people who then successfully complete the diploma year, they have a choice as well. They can decide that that's enough at that point and take their diploma and move on into their careers, or they can decide to continue into the master's year. And that might be a straight continuation, or it might be after a pause of a year or two. The master's year itself is focused on the production of a 10,000-word dissertation on a topic that is agreed between you as the student and the supervisor who is assigned to you. Within that year, we have 6 contact teaching days split into 3 groups of 2 days, one normally around September or October, one at the beginning of January, and then one around April time. But the majority of your learning through that year is highly self-directed, with the guidance of a supervisor to steer you through the project that you want to pick up on. And we've seen students come through with a range of interests and pick up a range of different dissertation projects. Some of those have touched on medical education, some of them have covered medical ethics, some of them have involved primary research by the students themselves, where they've actually gone out and engaged sometimes with patients and sometimes with colleagues to address issues that are of direct interest and concern to them in their day-to-day work. And we also have students who will engage not in primary research, but in secondary research, where they will look at addressing particular questions through the literature that has already been published, either through things like scoping reviews, pseudo-systematic reviews, or thematic analysis. And again, depending on the focus of the individual's preferred research topic, We will then provide supervisors who are able to guide and steer that project throughout the entirety of the year. So that gives us an overview of the different parts of the course and the core elements of how it's constructed and how it fits together. What I will do now is I'll just ask our three students just to say a few words about why they've chosen the courses and how it's been beneficial and helpful to them in their clinical work. And we'll go through, I guess, in order of where they are at the moment. So we'll start, Sharif, with you as you're on the postgraduate certificate. Then we'll move to you, Kauta, for a perspective from the diploma. And then we'll move to Ilyas to hear about somebody who's been through all 3 years. So Sharif, over to you.
Yeah. So, a little bit about me, firstly. So, I'm doing a specialized foundation program in leadership and management, and I'm currently in my F2 year. And prior to entering F2, and a core part of my specialized program is being able to access a postgraduate course. And so I have had to look around at sort of the things that were available out there, and have obviously decided to pursue the Crell course here at Cambridge. And that's for a few reasons, and to sort of go into them briefly. Firstly, is how broad this course is. Like Thomas was previously alluding to, it covers very broad themes of research, education, and leadership, which are very relevant to someone like me who is junior in their career. And I have aspirations as well, secondly, to do pediatrics and work in an environment that delivers evidence-based care for children, and to be a leader in improving services for children. And so I felt that the different learning outcomes from all of those modules within the Corel course were something that I could translate into my day-to-day practice and into my career progression. Um, and one of the things that, in particular, that I really value about the course in general is how different everyone is on the course. And there's so much to learn and take from the people that you're surrounded around um, within that setting. And I'm really glad that it's something that I decided to do. And I look forward to continuing it into the diploma and the masters eventually. But yeah, I've had a really good time.
And Sharif, just to come in there for a second with a very quick question, we use the term CREL a lot. So any course will tend to use its own terminology. Can you explain to anybody else on the call when we say CREL, what are we meaning by this?
Sorry. So CREL is the acronym for the title of the postgraduate certificate. So clinical research, which is the CR, E for education, and L for leadership. So it kind of forms a nice word to say with ease.
I think we get
Thank you. I
so
guess
familiar
as
with that
medics,
terminology.
yeah, as medics, there's a tendency to
Yeah.
acronym everything, isn't there? Thank you very much, Sharif. That was useful to hear. Kauta, hand over to you now.
Hi there. So the reason I was drawn to the, I want to say CRAL, but the certificate in research, education, and leadership is just that it covered so many different areas. I had an interest in teaching, a background in doing research, and of course, in general practice, leadership is always necessary as you broaden and you move up into your career. So. It really touched a lot of different areas that I felt were necessary in medicine. In my experience, it's actually bolstered my ability to work within teams and the confidence to bring in new projects. And I've seen that effect just within 1 year or a year and a half, even though you took time off in between. It was actually quite useful just getting that first year and a bit of experience and seeing it's kind of like role models, and you can work with the tutors and gain advice from them. So it really is a practical course, I think, compared to other courses where it's more you're being spoken to, and lecture-wise, you still will get that aspect, but it's more life skills that are ingrained in it as well. So it's more holistic in terms of benefiting your portfolio and things moving forward.
Thank you very much. Ilias.
Hello from me as well. So I think my journeys started as a core trainee now on the specialty part of my training. And what attracted me in the course was the educational element. I've done research before, so the thing that I wanted to improve on was education. 3 years down the line, having been through the three levels of the course, I have to admit that uh, well, there are multiple different courses that you can do. This, for me, that what stands out for that course is the effect it has had to my day-to-day practice. Not only in a direct way, the impressive thing is the indirect way that it has improved my practice that I only realize when I do my retrospective analysis to how have I done things differently throughout the past 3 years. Um, Whether we like it or not, medicine and clinical practice is potentially the most team sport that exists, as far as I'm concerned, out there. And what this course does brilliantly is bringing those three pieces together. You can become a great educator by understanding how you can lead a group. You can become a great clinical lead by understanding where your team requires better teaching or better knowledge, and you can become a better researcher when you can understand the data that are there and how you can interact with those data or with the ethics that are involved to that. It is a demanding course, to be fair. It's definitely something you need to work hard for. But the outcome of that, not only in a direct way, but this passive learning that becomes almost living part of yourself, is what has changed my practice. I truly believe that I understand and have a better input of the surroundings I have in a clinical environment by the skills that I have developed through this course.
Thank you very much. And thank you all for highlighting the things that you found beneficial through each part of the course that you've engaged with so far. So we've got a few questions that have cropped up, so we'll just run through those. And if there's anything else that those of you who are listening would like to drop in that we haven't answered already, or that we don't now, or that maybe stimulates another question from you, then please do put those in the Q&A section as well. So the first one that's come up, I think we probably have touched on, but I just want to make sure that the information is absolutely clear for everyone. And that question is, after completing the postgraduate certificate in clinical research, education and leadership, what are the criteria for progressing to the diploma and then the MST in clinical medicine? And so just to clarify for everybody, the requirement for progression is that you pass the year before. So to go on to the diploma, you need to have passed the postgraduate certificate, and to go on to the MST, you need to have passed the diploma. But there isn't a set mark threshold. It is simply the pass criteria. And the reason that we've done that is that we recognize that the diversity of topics on the course means that we will have people who maybe excel in the education elements but find the research parts harder. The diversity of the different years on offer means that actually you can progress in the second year, for example, and pick up new topics that weren't covered in the first year. And therefore, if we'd put in a mark threshold, we felt that that would potentially disadvantage some people who would be able to benefit immensely from progressing through the course. A good question here that maybe, Thomas, you might want to respond to begin with. And it states that the well, let me just rephrase it as a question. So I guess the question is, can you provide some application for an American context, as most of the classes and information seem to be focused on the NHS?
That's a really interesting point. We tend to have actually a wide variety of people from the from the world coming on the course. Even though we're based in the UK, we have many people who are overseas qualified. We have many people who are practicing abroad. The interesting thing with the NHS structure is that in looking at the NHS structure, you've got to go back to the nuts and bolts of clinical leadership, clinical education, research on there. The basics of all these are going to be applicable right across the board. And whether you're working in North America or the Middle East or Australia or South Africa, these are all people we've had on the course previously, um, and who have then been able to not just take the knowledge and skills and behaviors and attitudes that you develop on the course and bring them back to your own workplace, and they're applicable there, but also to be able to bring your experience of your own healthcare setting and inform us on the course. So much collaborative working. So even though we might use NHS rules and regs and UK law as examples of how to implement these things, absolutely what is being discussed is really universally applicable. And we do look at what happens in other countries as well. And particularly on a course like this, we ensure that the course is tailored to the people who are on the course. So if you happen to be working and practicing in another country, we'll say, great, let's see what we can focus on for you. And the final point on that is one of the people who comes to teach and to engage on the course has been a quality improvement fellow at Harvard for the past several years. So we have people who have that real lived experience to be able to bring to that North American audience as well.
Thank you very much. This next one, Rosie, might be for you, actually. And it relates, I suppose, in a way to financial support for the course. And so the question really is, are there any bursaries or scholarships available for students studying the programme?
Yeah, so there's not a specific funding or bursary for this program that we administer. There is quite a lot of information on the PACE website and also the Central University website about funding options and bursaries. So I would recommend that anybody has a look at the PACE website where the funding information is. There's a link to that on the fees and funding section of the CREL applications page. So where you click to apply, there is a fees and funding section, and that links out to the PACE website. I would say that from experience and from our past students that have studied on all three courses, the majority who have been successful in gaining funding have done that through their employer or through their NHS trust. So that seems to be a really good location for people to search for funding outside of what's available through the university.
Thank you very much. I saw both Sharif and Ilyas nodding there about employer support. So I don't know if either of you would like to just elaborate a little bit on either your own experiences maybe of seeking funding or that from colleagues who've been through the course.
Yeah. So, as part of my specialized foundation program, the deanery that I work under has given me sort of a capped amount to be able to use that money to be able to do a postgraduate course. Now, I'm quite lucky in my deanery and with my program because I had the flexibility to explore and use that wherever I wanted to. But in my experience of applying for the postgraduate certificate, it's quite simple to organize if you are eligible for it from your employer.
And what I would add from a perspective of someone who done a core training outside of a normal training pathway and therefore did not have access to funding this way, I still got funding through my own trust that on 1 year and through my dinner, despite not being a formal training number training, on the other year, as there are funds like that available by dinnery and by region. So I would say definitely speak with your medical education department in your trust or in your hospital. They could potentially provide very useful information about what might be available either for part or full funding.
Thank you. I don't know, Kautar, if you've got anything you want to add on this topic.
I think it will depend on deanery to deanery. And our particular deanery, they can be a bit more particular with whether it's medical education or what the label of the course is. But then it always comes down to who's reviewing the applications that year. So I would always say put in your application if you have any kind of funding in your deanery. I think it's a lot more generous for F1s, F2s. But I would always put in the application if you see a deadline that's coming. That's a good option, even if it covers part of the course.
Thank you all very much. And I guess as someone who sits more on the employer side rather than the student side, I would definitely advocate for talking to your employers about funding options. And if they need to come and talk to somebody who is involved in the course about exactly what it is we offer to help, convince them to support you in that, then there will be somebody who will be happy to have that conversation. So we've got another question, which again, I'll come to you, Thomas, for this one, and then I may chip in afterwards myself. It's asking whether the program considers, and I guess this is in relation to the postgraduate certificate to begin with, considers applicants who may not yet have extensive research publications, but do have strong clinical and community health experience, particularly actually in an international context.
And again, that's a really good point to think about. Who can apply for the course, who is accepted on the course, who is the course for. And really the course is for anybody who is in a clinical based job, who wishes to have more formal qualification and training in leadership, education, and research. So the fact that you don't have current publications in research means, well, actually, that's ideal, because this is the course that will take you through the initial basics in the certificate of establishing what research is, how to carry out research, how to analyze research, and then as you go through the diploma and the masters, actually working through to be able to do that at a practical level. Essentially, if you have all of the skills in research, education, and leadership to begin with, then why come on a course for that? If you don't have those skills and don't have that experience, that's the reason to come on the course, is to build those. So whatever you see at the moment is your own educational need, is the gap in your own CV, then that's what the course is designed to help to fill. I heard you say, Tom, that question again was thinking about student at an international level. And something that we find is that specifically students coming from an international setting might say, well, I've done a lot of these things, but I don't have the formal basis to be able to prove that I've done them, or to be able to use that in an employment application or in a CV, or in an application for a promotion, whatever it happens to be. By coming on the course, you get that formalized, so you can actually then prove, well, not alone do I have some experience in this, but I have the training, and now I've shown that I've hit the learning outcomes, and that I have a formal approach to this, which then you can use to get you where you need to be.
Thank you very much. And there are some questions that have come in, which I think are probably more practical elements, that talk about application deadlines. They talk about information around fees and funding. They talk about general information around the course. And a lot of these are available on the PACE website, and it may be possible for us to drop that into the chat if it's not already there. For the current application cycle, the deadline for applications is the 28th of May. The course fee information is there on the website. And regardless of whether you decide to apply for this intake, or whether you listen to this and you're thinking about, okay, this is interesting and this is something that might be useful for a future year, the most up-to-date information will always be that is on the website. Yes, Thomas.
And the question which cropped up yesterday, which I think is very pertinent to this as well, the question was, is this a full-time course where you've got to be in Cambridge for the whole year, or is it a part-time course? And then if it's a part-time course, is it possible to manage working in your normal clinical environment at the same time? So to answer that, it is a part-time course. There are really, generally for each year, there is a bundle of three separate areas of contact days, one in the first term, one in the second term, one in the third term. And those contact days generally take place in person. There is some online learning in between those. For the question about, can you manage your own full-time clinical post and also manage the part-time course, probably good if I open that up to you, Kauthar. I see you smiling there. Is that something that you can help people to answer?
I think it's certainly doable if you manage your time. It's usually good to optimize, when you've got an assignment, to try to get as much of that consolidated during that week that you're there because you're very focused and you can ask as many questions as you need to. Um, I certainly wouldn't try to leave things to the last minute, but it is manageable. It is a part-time course. I think the course tutors are very understanding of the fact that we've got other things going on. And even if there needs to be other keeping in touch days virtually, there's a lot of accommodation in terms of trying to make sure everybody's timings are met or recording the sessions so that people can still attend those if they're on call. So I found that the course has been overall quite accommodating for people who obviously have jobs outside of the course and are doing this on the side. So it's been a positive.
Thank you, Catherine. Sharif or Ilyas, anything you'd like to add in terms of managing a part-time course and also working clinically?
Yeah, I agree with everything that Coulter said. I would like to add though that I think it is pertinent that we do attend contact days, and I think prior to from what I recall, prior to actually accepting a place onto this course, I had to get confirmation from my employer that I would be available during those blocks of weeks. Like Thomas had said, one in the first, one in the second, and then one in the third. So they are very important to attend because I would say the bulk of learning is within those weeks. But yes, it is very manageable. Yeah.
And just leading on from then, something that always crops up as well. Is it an online course? Is it just where you read through information and then spit the information back out in an exam? Very much, it's not that type of course. It is designed to be interactive and engaging, and you're not just arriving along to Cambridge and sitting in a classroom and being told stuff. So again, Sharif, while you're on the screen there, would you like to give any input on how you find that interactive level of the course?
Oh, yeah, absolutely. I one of the things that really pleasantly surprised me was the different methods of learning that we employ when doing this course, and that our tutors use when delivering it. And I think that one of the things that I was quite quite surprised with as well was how things that you initially think are sort of unrelated, towards the end, you find links between them. And I think it's a really different way of forming associations between different things in clinical research, education, and leadership, that you can sort of internalize within your own day-to-day practice. And I think it is very it's not that sort of traditional sort of learning where you're sat in a lecture theatre and half asleep. It's very much the opposite of that. There is a lot of sort of small group work, larger presentation delivery, more academic types of activities with research, and yeah, it's a really good mix, and you don't get bored.
Thanks. Ilias, anything to add into that?
I think the my point kind of relates to both the last questions that have been
Mhm.
made. An excellent point that's been made throughout the course that you realize retrospectively the importance of it is that try to come up with a project, try to come up with something that is relevant to your workplace. So yes, this is a part-time course and you need to invest time in that. That being said, you can make projects and you can pick up assignments that are relevant to your workplace that you can, in a way, while you're doing something for your workplace, this can also be applicable for your own progression through the course, not only in ticking the boxes, but also you developing the skills that are needed to develop what you need to do. And I think that the interactive level of that is what makes the difference in the in-person days. At the end of the day, a significant part of the course is education, so it is expected to try to use different type of educational modules and tools rather than just this one-way traditional learning. In my cohort, we had a little bit of two teams split up, and there was a 3-year running competition between the group collecting points. So it had its own fun. Just connect with each other, and it's not just something you do completely on the side of what you're doing, but in the whole context of who you are as a clinician, as a leader, as an educator.
Cool. Thank you very much. I think, as far as I can tell, that's all of the questions that have come up that have been addressed now. I will just give a quick sort of 10-second pause in case there's anything to rush in. And if nothing else does crop up in that time, then we will wrap up the session for today. I can't see anything coming in at the moment. So it's been a pleasure talking to you today. For those of you who are listening to the recording, I hope you have found it useful and helpful as well. And I very much hope that we will see some of you applying to the course either for the next intake or a future intake. So thank you ever so much for your time, and best of luck with your applications in the future.